ऊंचे कदम भरे दूसरों के जैसे पहले खुद को जय करे हमको मन की शक्ति देना मुश्किलें पड़े तो हम पर इतना कर्म कर साथ दे तो धर्म का चले तो धर्म पर खुद पे हौसला रहे बदी से ना डरे दूसरों के जैसे पहले खुद को जय करे हमको मन की शक्ति देना।
Good morning, all. Giving tribute to our master Samuel Hahnemann, who made this science and taught us dare to be wise, seeking blessings from our Guru, Dr. Prafull Vijayakar sir, who bridges this wonderful science with the modern science and made homeopathy very easy. Jai Hahnemann, Jai Homeopathy, Om Vijaykaraya Namah. We are in learning of the organon of medicine, 6th editions. So in yesterday's session, we have completed the footnotes and aphorism number 7. So today, aphorism number 8. It is not conceivable, nor can it be proved by any experience in the world, that after the removal of all the symptoms of the disease and of the entire collection of the perceptible phenomena, there should or could remain anything else besides health, or that the morbid alterations in the interior would remain uneradicated. This is very important aspect of after removal everything perceptible phenomena, only and only thing remain is the health. But what happened at the time of Hahnemann era, there was a hypothesis that homeopathy remove the symptom but disease remain. So this is what a controversial point where Hufland has contradict with the Hahnemann. So it was given in a footnote number 5. So when patient has been cured of his disease by a true physician, means a homeopath, in such a manner that no trace of the disease nor morbid symptoms remain, and all the signs of health have permanently returned, then, without offering an insult to common sense, how can anyone affirm in such an individual the whole bodily disease still remain in the interior? So this is what Master Hahnemann is telling us. And yet the chief of old school, Hufland, assert this in the following word, that homeopathy remove the symptom, but the disease remain. This he maintained partly because of mortification at the progress made by the wonderful science homeopathy to the benefit of mankind, and second, partly because he still holds thoroughly a material notions respecting disease, which he is still unable to regard as a state of being of the organism, wherein it is dynamically altered by the morbidly deranged vital force, as an altered state of health, but he views the disease as something material. After a cure is completed, which may still remain lurking in some corner in the interior of the body, someday during the most vigorous health, in order to burst forth its pleasure with its material presence, so dreadful is still the blindness of the old pathology. So this is what very beautifully Master Hahnemann said that when the perceptible phenomena has been removed in the whole extent, then there could be only the health is restored. But they cannot understand that it is the diseases because of dynamic derangement. They only understand the disease because of some material cause. So no wonder what it could only produce a system of therapeutics which is solely occupied with the scoring out of the poor patient. So this is what Master Hahnemann is telling us. So we will continue our learning on the theory of separations. So as far as we have learned the chapter 7 in this chart of separation. So we have understood the chart of separation from the ectoderm, endoderm, mesoderm, organ of endocrines, change in the neural plates and the CNS and somatonervous system, and finally landed with the change in the genetic code. So today, today we go to the another chapter of theory of separations. We have to understand. So in yesterday's sessions, we have learned about when we are treating the patients. So what we have to consider into the patients, the innate genetic characteristic at the level of mind, the physical part of the body, its build, and the general part of patient tolerance and everything that we have to consider. So this is what we are treating man as a whole, not the particular part or the system. So for that, Sir has proposed that when you are prescribing the right constitutional medicines, considering the whole phenomenon, like the basic nature or the mind of the person's non-disease nature, second, the build, look, peculiar behavior and speech, third is the emotions of love, hate, fear, desire, aversions, and the physical sensitivity, fourth is the tolerance. So when you are considering all these things, it is called as the constitutional simillimum. So when you are treating this at the genetic level, Sir proposed one coin, one term. It is called as genetic constitutional simillimum. So today we are learning about the science of genetic constitutional simillimum. So every homeopath is holistic healer. Therefore, he has bounden duty to know the makeup of the man, what constitutes a man, and how his organ functions. So we need to understand the man. So man, we all know the man is made up of the multiple complex phenomenon and multiple systems. So all the system is made up of the organs. The organs is made up of the tissues, and tissues is made up of the cells. So when the cells contain the nucleus, and that nucleus contain the chromosomes, and that is a DNA. Okay, so human being is made up of the unit of the life called a cell. So all cells have some basic structure, whether it belongs to a particular skin, bone, liver, or brain. So all cells have certain functions and certain structure. These all cells have a nucleus with a chromosome, and this chromosome bears on them a large number of the structure called as genes. Now, genes are units which guide the performance of the cell. So this is what something that our gene is encoded with the certain process, and that process and informations is guided by our genes to perform functions in each and every cells. So these genes have the triplet code called genetic code, which are inherited from the parents. So genetic code is entirely responsible for what going in constitution, the resultant individual. So why this genetic code is? I will share one example that when you are going to make a building, so before making the buildings, you need to make a map, and that map is what you have to put this. The map is this building rooms is of this size. There is a window, there is a door, there is ventilations and everything. So before making all these things, this is giving you a map, and that map is encoded into a architectural plan. So that architectural plan is already encoded in our genetic code, and which constitute the resultant. So whenever the building is made, whole building, so this building is resultant things. But before that, it was written into the architectural plan. This is called as the genetic code. So genetic code is entirely responsible for what is going to constitute. So if we have that plan, then we will say that this building is look like this. So this is what the resultant individual. So this genetic code is responsible for what? So this genetic code is responsible for the structure and the build and the look of individual. And the second, the basic nature of the individual. And the third, the nature of upset physical and mental that he will be prone to. The fourth point is tolerance to various external factors like heat, cold, wind, sun, moon, rain, sound, light, electrical disturbance. So to take it into considerations of the same thing, example, then the building is created. So what is that building is? So building is look like the building is look like the pillar is like that, its direction is like that. So this is what the structure of the building. When the building is structurized, there should be an interior and a looking. So that is the interior gives rise to a basic nature of the individual. The third part, the nature of upset physical and mental that we will be prone to. So sometime what happen, this building is prone to if there is earthquake is happening, what happened to this building. So this is what the before making the building, all the plan has made by architectural, that if this is happening, if there is a tornado is coming, what will happen. So this is what the plan. Okay. And his tolerance to various external factors like the heat, cold, sun, wind, moon, rain, sound, light, electrical, that means what, any disaster happen in the future. So we have to understand this building is tolerating or not tolerating. If the earthquake is happening, if the tornado is coming, if a tsunami is coming, so this is what we have to understand. So this is same way in the human. Our genetic code is responsible for the physical structure and build of the individual. When the physical structure is prepared, it is also the basic nature of the individual. That means the emotional mind. The nature of upset physical and mental that he will be prone to. That means there is a sensitivity and susceptibility in each and every individual cell, which giving rise to if anything is happening, there must be some physical disease or there must be some mental reactions. And also the gene is governing that there is a tolerance to external factor when the man is exposed to the external environments. So this environment is giving input, and our genetic body, our genetic individual is responding to the environmental stimulants. So this in this response, if I am tolerant to that, my response will be less. If my threshold of tolerance is low, then I might affect it. So this is what that there is a certain individual who are affected with the sun. So their tolerance to the sun is low. That's why the sun aggravating. Tolerant to the rain is low. So that's why they are aggravating. Tolerant to the sound is low. Threshold is low. So they're affecting. So this is what governed by our genetic code. Now, how does this code express? This is what we have understood. But how does this code is expressed? This genetic code expresses itself by synthesizing protein. Every character represented on the gene is expressed by the synthesis of the protein, the unit of the itself. Okay, now what is this protein? See, we know the DNA. DNA is made up of amino acids. Amino acids is the small unit of the protein. And we all know our body is uh, a complex phenomena, but at the end of all the process, Krebs cycles, phosphorylations, and every situational process, at the end, there is the process called as enzymatic activity, and that enzymatic activity is done by the process of the protein. So either a synthesis of the protein or less synthesis of the protein. So there are protein is the only things which govern everything. So these protein are of two type. So what are these? The one is a structural protein and one is called as enzymatic protein. So now we have to understand what is a structural protein. The structural protein are responsible for the solid structure of an individual. These proteins are synthesized differently in accordance to the nature inherited by the individual. Hence, the shape and the feature of the face of a person shall to a great extent reflect his nature. So this is what very important. So whenever a child is born, so in the family, everybody is happy seeing the child, and they said, "Yeah, this child is looking like his father. This child is looking like his mother. His eyes is like the grandparents. His nose is like a grandma." So this is what that structure is encoded from the inherited from the parents, and that protein giving rise to a structural development. The second protein, which is called as enzymatic protein, these are synthesized by the derepressed gene. These are fluid protein which forms the part of the human biochemistry and are circulated in the blood. These proteins are either in the form of enzyme or catalyst and are associated directly or indirectly with the all these reactions in the complete the balance and not independent of each other. This balance is called as homeostasis. So in maintaining the homeostasis, our body is trying to balance the enzymatic activity, catalytic activity, and everything. So this is creating the balance in the body. And in the definition of homeostasis means it is a balance between the physical, mental, spiritual well-being. So that is what the optimum health is maintained. If any disturbances in the above balance is due to malsynthesis of the protein, which is genetic in origin, one thing. Second, introduction of any foreign protein into human biochemistry or humor by means of vaccination, insect bite, bacterial toxins, toxins from killed bacteria after antibiotics, proteinous ointments, etc. The third point, the protein synthesized by body cells themselves due to shock, grief, mortification, which upset the homeostasis, causing illness or disease. And the fourth one, a reverse RNA and DNA synthesis, which may result in a grave disease like the cancer. So, disturbed homeostasis impairs our immune system, our immunity, and causes physical symptoms as well as mental symptoms. So, this is what we have to understand that what is this? Any disturbances in the balance. So, homeostasis is, sorry, homeostasis is disturbed because of malsynthesis of the protein, which is genetic in origin. This line gives rise to a genetic mutation. That means that protein is not expressed in the proper synthesis, and that leading to the genetic mutations. Okay. So one thing is genetic mutations, which gives rise to a disturbances in the homeostasis. Second, introductions of any foreign protein. So the vaccination is one of the reason. Insect bite. In insect bite, what happened? Some of the chemical which is introduced in our body, and that chemical protein causes toxins in human biochemistry, and that leading to a certain phenomena which we call as a hypersensitivity reaction or sometimes the anaphylactic or an anaphylactoid reactions. There are bacterial toxins which also disturb the homeostasis. So all this gives rise to only and only that we need to understand what was the protein imbalance happening to the patients. And when we are understanding this, then and then we have understand that we are treating man in disease, not the disease in man. Because this protein imbalance is nothing but it is the expressions of the genes. Hope you all understood this in a proper sense. The chapter 8, the first we learn about the genetic constitutional simillimum, the science. Why Because we are considering whole. This is a small protein imbalance at the level of body, at the level of mind, at the level of gene, which represent the individual as a whole, as a constitution. Now, what is emotional prescribing? This biochemical homeostasis, when disturbed, can influence the limbic system along with the hypothalamus and stimulate the various nerve centers to secrete different neurotransmitters. Okay, like secretion of the dopamine, epinephrine, norepinephrine, enkephalin, endorphin, adrenaline, etc. can be in excess or deficiency depending upon the basic nature of the patient. This dependent upon the genetic code, sad constitution like Ignatia, Natramure, acid sepia may have genetic tendency to less secretions of the norepinephrine or serotonin. So serotonin is for happiness, but when serotonin is reduced, what happens? They become sad. Okay. Cheerful, mirthful constitutions like cannabis indica, lacasis, hyoscyamus, belladonna may have a genetic tendency to secrete more dopamine. So when you are around with this kind of constitutions like cannabis, lacasis, hyoscyamus, and belladonna, they are all having a vivacious, cheerful appearance, and that is because of their body is secreting more dopamine. Thus, various neurotransmitters will be secreted in different individuals in different quantity, giving rise to these individuals their basic characteristic, which incidentally correspond to their basic structure, features, etc. So secretion of this neurotransmission can also come about in excess or be deficient in individual due to certain phenomena happening in their life, like sudden shock or a prolonged grief or apprehension or some mortification. In these cases, this neurotransmitter level increase or decrease temporarily. Very important aspect of this is very important. Temporarily, giving rise to a temporary change in attitude and behavior. So this is what something you have to understand. Something which is temporary and it again return back to the normal. So this is not the constitution. This is just a tendency or this is a temporary because of certain ailment is happening. So this is mostly emotional prescription is mostly in acute cases when emotion has to be consideration. Whenever you are treating a chronic cases or a structural changes cases, in that case, emotional prescription having a lesser value. You need to consider the emotion of the patient, but before considering emotion of the patient, you have to understand the man as a whole at the mental, physical, and general level. So, at the mental level, you have to understand the will, intellect, and moral aspect of the patient, and then you have to consider the emotion and attachment and sensitivity of that individual. In physical, you have to understand the build, his look, postures, gestures, and everything. In general level, you have to understand the thermal, thirst, and tolerance, and desire aversion. So this is what very important. For example, gelsemium in nervousness, staphysagria in mortification, ignitia in grief are the classic example of the prescription on local emotional level where basic genetic code is neglected. So this is what happened. Sometime what happened? The someone in the family died, and patient is not expressing his grief, and she goes into a silent grief, and we prescribe a ignatia. So that ignatia will make them temporary relief. It is not that the constitution is ignatia, but it is the state because of the environmental factor, which is a sudden shock of grief of losing person. So this is what emotional prescribing is. So, in this emotional prescription, we do not neglect the genetic code, basic genome. This amount to prescription for a disease in man rather than man in disease. So, for example, we know that ignitia is a remedy for acute grief, whereas metramure is remedy for chronic grief. Okay, so this is what something that we are not treating the man, but we are treating the disease in this amount of prescribing for disease in man rather than man in disease, which may lead to the dangerous suppression if the vital force is not strong enough to resist it. This is very important learnings. So prescribing for delusion, illusions and hallucination and only on the mental sphere without considering the general and physical makeup is what is known as emotional prescribing. Okay. The effect of various neurotransmitters on the human mind is shown in table below. So we are looking into this. So neurotransmitters, it is the hormones which is made up of protein and their effect. So if there is a block in norepinephrine and serotonin, which causes sadness, despair, grief, unhappiness, misery, reduced appetite, reduced sex drive, reduced sleep, and there is a psychomotor agitation. Okay, increased dopamine. If there is a dopamine is increased, it causes a sense of persecution from outside sources. So they having a feeling that something is happening. We hearing of voices. So it goes into delusionally disorders or illusionals, incoherent speech, dislocations of the idea, abnormal sequence of thoughts, and abnormal postures. So this is what if the dopamine is increased and if dopamine is reducing, so it may lead to the Parkinson's disease, depressed state. Okay, encephalins and endorphin. Encephalin and endorphin is for the pain, so it causes suppression of the pain. So most of time you find the constitution who do not feel the pain either goes into state of indifference, having no complaint or contentment. These are because of encephalin and endorphin. So we have the remedies like opium, painlessness of painful complaint or contentment. So this is what magnesium is acting on these neurochemicals. Again, we know the thyroid hormone. The thyroid hormone causes overall metabolism, so it increases the activity of the body and the nervous system. Even our testosterone and estrogen, when increase, it increase causes increase in the libido. Then 6-7 fragment amino acid of ACTH causes intense fear. PEA, very important. Whenever you are eating chocolate, it will stimulate PEA, phenylethylamine, and it increase the feeling of love. That's why in Valentine's Days, everybody giving chocolate to their loved ones. Again, oxytocin is increased. It causes desire to hug. Again, it is a love hormone. It produces contractions and relaxations at the level of heart. So this is oxytocin. So doctors who consider only physical symptoms are tempering the homeostasis at local biochemical level. This upset the homeostasis further in a deeper and deeper tissue and transfer the toxins higher to cause disease suppression. If doctor who consider only mental, as shown in the chart, are actually suppressing the motor neurons which secrete a particular neurotransmitters, prescribing for the core of the suspiciousness, people are talking about me, laughing at me, etc., is the symptoms of Baretta cough. Baretta cough might help temporarily by decreasing the synthesis of dopamine, but the drug may not hold since actions and reactions are equal and opposite. So patient might have rebound, aggravations, and the doctor may become helpless. This plight of homeopath is because he has not considered patient as a whole. The patient in question was not Baraita but his state or symptoms were. So this is what emotional prescribing. So we limit our reading here, and if you have any questions, you need to ask on chat box. Any questions? Up till now, we have learned many things. Okay, so if you have any questions, let me know. What is the difference between the constitutions and dispositions? We will learn this in later, Dr. Kushbu. So you need to wait for that. It is in the pipeline. We have to understand everything. So this is what sir has proposed. In chronic cases, what is the time period to wait for second prescriptions? Okay, fine. What type of chronic patients you are asking for, doctor? There are three type of the chronic patients. One is physiological chronic, means physiopathological. The sora is in the background. The another chronic patient is a constructive defense mechanism. The growth is there, chronic growth leading to tumor, cyst, and the growth of the particular parts and organs. And the third one is destructive chronic patients. So in each and every chronic patient, you have to understand that the process of miasm has to be reversed in the second prescription. So, if the patient is going from psychosis, means a structural constructive to the structural destructive things, you need to limit that this prescription is not right. It is not the time bound that patient is we have to wait for a particular time. I have to wait for 3 months, I have to wait for the 6 months, I have to wait for 2 months. Say, for example, if the patient having a PCOD, okay, and we are treating them. So, what happened? The regularity of the menses has been disturbed, okay. So, when the menses regularity has been disturbed, we have prescribed certain medicines. So, after a prescription, our medicine make the patient physiology to the normal C by changing into biochemistry and changing into the cystic lesions in the ovary. So we have to wait for 1 month. That cycle has to come. But in the next cycle, patient might develop hemorrhagic cyst. Okay. So looking into consideration that we are treating the PCOD. And after the PCOD, the patient might develop a chocolate cyst. That means patient is purely in a psychotic state, went into psychosyphilitic state. So this is what without wasting for a time, you need to intervene that you need to prescribe another remedy which covering the as a whole because our remedy is partial. That's why the progression of miasm from psychosis to syphilis. Okay. Say, for example, in same case, if the patient is coming to you with the chocolate cyst and you have prescribed a remedy based on the constitutions, on the basis of that, the patient has reversed. So, in 1 month of span or 2 months of the span, patient didn't get menses, but the chocolate cyst has been dissolved and it becomes a simple ovarian cyst. That means it is a reversal of the miasm. So you need to wait for a period to come. Again, this is what a reversal will help you, that it is not the time factor will tell you that I need to intervene or not intervene. So you have to put into these things mind that the compass is the reversal of miasm and reversal of the disease from the higher to the lower layer. So it is not the question of the time, but it is the questions of the reversal of miasm. Hope you got your answer, Dr. Sejal. Yeah, Dagorc. If the disease of the third layer psychosis treated with the homeopathy, disease gone and a new symptom develop in the second layer or the first layer, but the miasm is syphilis. This is suppression. Need to change the medicine? Absolutely. See, miasm is the prime things. That means you have to understand that the reversal of miasm very important, because what you are going to treat the defense mechanism at work. Okay. So what is that? The syphilis is going to destroy the patient. So that has to be checked. Okay. So in that case, you need to prescribe the remedy because your medicine has been partially acted. Okay. This is not the constitutional prescribing. Sir, how to get the recording of this? Sorry, doctor, this is not the question to ask in this session. How to proceed in case of ankylosing spondylosis means which type of rubric we. Dr. Akash, ankylosing spondylosis is a kind of autoimmune disorders, and in that case, you need to ask for you need to take the rubric of autoimmunity. So you need to understand the miasm from psora, psychosis, and syphilis, and then in the syphilis it is considering. So you need to understand the autoimmunity at the level of mind, and on the basis of that you need to prescribe. So I'm not going into detail of the rubric what we have to take. In a whole lifetime, is there any only one GCS or GCS can be changed in different stages of life? How? As GCS is based on genetic code of the cell and it's by birth, then how it can change? It's a very tricky question, Dr. Manhar. I understood. This was the same question happened to me in my mind that does we have a boon that we find out one remedy and anything happen to us in our lifetime, we apply that remedy and we will get cured, or we will have what we called as a tool that we never get ill. So we cannot become immortal. Okay, unless and until our body is expressing something. Okay, so it is not to give the answer like the GCS remains same to whole life, but you have to connect the dot that this is the constitutions from the childhood to the adult, adolescence, the adult, and then in the old age. But that is what connecting the dot from childhood to the syphilitic state. So that gives rise to a whole aspect of one component of the medicine. So that is GCS. But whenever certain emotional element is happening or certain shock is happening, so what is that our genetic code? There are the two type of genetic code. One is called as expressed gene and another is called as non-expressive genes. But whenever the circumstances happening into our life, that non-expressive genes become expressive. So the our system has changed our adaptation to certain extent. At that time, we have to understand we require some different remedy. It's the same way what Master Hahnemann has told that there is no single remedy to cure everything. In that case, you need to require many remedies in succession. It was written in aphorism number around 170 to 178. Okay. So this is very early to give answer to this question that it is, yeah, we know it is based on the cell genetic code, but we have to understand that it can change because of epigenetic factor also. In case of urticaria, if urticaria is better but menses are dark, change and hold the medicine. Okay. So menses is dark means what? You have to understand. And urticaria has a two variant. One urticaria is the soro-psychotic. That is, sora means the sensitivity. Psychosis means that there is a swelling and edema. Okay, this swelling and edema because of sensitivity got hurt. Okay, this is soro-psychotic. And one urticaria which is called as angioneurotic urticaria, in which the excessive swelling out of control, which may land up into anaphylaxis or which may land up into emergency condition. So you have to understand which type of urticaria are you teaching. Okay, and what dark menses means. Okay, so dark menses means the psychosis. There is a fibrin in the menstrual blood is increasing, so it create a dark menses. Okay, so you have to look into consider if you are treating a angioneurotic edema and dark menses coming, that means you are reversing the miasm. Okay, and because of just dark menses, is there any pathology related to that? You need to look into consideration by investigating the patient. Okay, so that you have to count. So just in one thing keep in mind that miasm is the most important thing and compass to understand the things. Mm, If we give symptomatic prescription similimum, so suppression is occur based on, see, this is what we have to understand. If you are treating symptomatic, that means what? Two things happen. See, in acute cases, the definition is like acute disease either end into recovery or end into death. So this is a self-limiting disorders in acute. So in that case, body will take care of everything in spite of prescribing your medicines. Okay. But if it is a chronic cases and you prescribe on the basis of symptom, so that symptom has been suppressed at one layer and it might goes into another layer. So it can happen in. Dr. Kushbu, you need to investigate what is the meaning of dark menses because of any pathology. Yeah. In PCOS cases, which type of constitutions are more susceptible? Uh, what you need to ask Dr. Gargo? Which type of constitutions are more susceptible means what? PCOS is a different thing. It's a syndrome, and PCOD is another thing. So there is a difference between PCOD and PCOS. मतलब कि conflict or sensitivity, it is not the right time to give you answer on this stage at this juncture. Whenever our journey is going far ahead, then we will talk about the conflict and sensitivity in the future sessions. Meet me personally, we will discuss it. Okay, great. Any questions? So, otherwise, we will end our session today. Tomorrow, I will not be available because of I am traveling. Okay, we will continue our session from Tuesday morning. Hope you all enjoying this. In case of psoriasis and lichen planus, so what will be the direction of cure? If the disease of the same layer, the direction has to be from above downward. Okay, because both are covering the dermis. You have to understand, keep in mind that psoriasis, crack has to be gone first, and then scaling, and then redness, and then finally the itching. In lichen planus, the thickening, so shiny thickening become reducing, then it become normal, then color is changing from darkening to the less darkening to the normal pinkish color, and then it went to the normal skin color. So this is what the direction of the cure, and in the same way, it is from above downward. So it has to be above downward. In the skin, it is not like center to periphery. It is above downward. Center to periphery is the corollary from most important organ to the external organ. So that is what center to periphery. In case of dermoid cyst, she had nausea, weakness, which got better, but appetite is not improving. Once she had a painful menses after 2 months. She has a fever of 99.3 and nausea and vomiting. Is this suppression or I need to reconsider or a state remedy? See, you need to ask two things. One is the physiological symptoms you are looking into, and one is the pathological things. Okay, so we have a complex disease we have right now. So you have to understand them miasmatically that the dermoid cyst is a psychosyphilitic in nature, and nausea is a physical symptom associated with certain emotional disturbances at a level of mind. It is called as a disgust feeling. So you have to understand what is going in the life of the patient and considering the whole aspect. So when you are prescribing a remedy for the patient, no syphilitic symptom will come. Okay, so in that case, you need to prescribe the constitutional medicines, not the state remedy, and that constitutional remedy will take care of the feeling of nausea, and his appetite has to be improving. First and foremost thing in the follow-up, general has to be improved. So when general has to be improved, that is the sign that your medicine is right. If generals has been not improving, that means you are somewhere wrong. So your remedy should be wrong. Reconsider the case and prescribe. Okay, so thank you so much for the today's session. So we will keep these two questions for the tomorrow morning, day after tomorrow morning. Okay, uh, the question is like skin eruption healed from age to center or vice versa. There is a question we will look into that, and suffering from the hypothyroidism and history of renal stone, and after the medicine thyroid is in no limits, normal limit, the renal stone reappear. Should I consider as old symptom reappear or should I consider it as per the theory of separation chart? So after theory of separation, we will going to read the miasm. So our many question has been clear with the understanding of the miasm. So I will take note of these questions and we will discuss in the Tuesday morning sessions. Dr. Tamanna, we will talk about it. Remind me your questions Tuesday morning. Thank you. Thank you so much. Thank you. So we are concluding here. Thank you all. Thank you with me learning daily. Thank you.